All right, everyone, buckle up, because today we are diving deep into something that could completely change how we experience healthcare, especially if you're on Medicare.
This is big, yeah.
It really is. We're talking about Advanced Primary Care Management, or APCM for short.
Catchy, right?
Oh, absolutely. Rolls right off the tongue. But in all seriousness, this new program is set to launch in 2025, and it aims to, well, revolutionize how primary care is delivered.
No more messing around.
Exactly. One of the first things that jumped out at me was how different this is from all those other programs we've seen, like CCM and PCM.
Totally different ball game.
Yeah, APCM is way more comprehensive. It's not just about keeping track of how many minutes a doctor spends with the patient anymore. It's about getting the right care to the right people based on their actual needs.
It's all about personalized care, right?
Exactly. So maybe you can help us break this down. What does APCM actually stand for, and what's the big idea behind it?
Well, when you get down to it, APCM is all about making healthcare more accessible, making it more effective, especially for folks on Medicare.
Makes sense.
It's a shift in focus. Instead of just dealing with health issues as they come up, APCM is all about taking a proactive approach to keep people healthy.
Okay, so I'm seeing this word tiers pop up everywhere in this document.
Ah, yes, the tiers.
Can you tell us a little bit about those?
Absolutely. So APCM has these 3 tiers, and they're designed to categorize patients based on how much care they need.
So not one size fits all anymore, huh?
Nope, not at all. We've got the basic tier, then there's the complex tier, and finally the high-risk care management tier.
And each one of these tiers has its own specific billing code, right?
That's right. We're talking G0556 for basic, G0557 for complex, and G0558 for high risk. Pretty straightforward, actually.
Okay, so how do they decide who goes in which tier? Is it all about how many chronic illnesses someone has?
That's a big part of it. Let's say you have someone with diabetes and heart disease, that would put them in the complex tier.
Gotcha. But what about the costs? Because I'm seeing some pretty big differences here. Basic is $10, complex is $50, and high risk jumps all the way up to $110 per patient per month.
Yeah, that's definitely something to keep an eye on. I mean, could this end up influencing which patients doctors are willing to take on?
That's a good question.
Will patients in that high-risk tier actually get all the resources they need? These are things we'll have to see play out.
And then there's this whole thing about RVU values, which I'll admit I had to look up.
Ah, yes. The RDUs, basically, it's a measure of how much time and expertise a doctor has to put in for each tier.
So it makes sense that the RVUs go up as the care gets more complex.
Exactly. For basic, it's only 0.17, but for high risk, it jumps to 1.67. That shows you just how much more involved treating those patients can be.
Wow, that's quite a jump. Okay, so we've got these tiers and the costs and the RVUs all figured out, but how does this whole system actually differ from what we've seen before with those older programs like CCM and PCM?
Well, the biggest change, and I think it's a really positive one, is the shift from time-based billing to what they call risk stratification.
Risk stratification.
Basically, instead of just clocking in minutes, doctors are now assessing a patient's overall risk and then providing care based on that assessment.
That sounds a lot more, patient-focused.
That's the idea. It's about taking the whole picture into account.
Okay, so it sounds good in theory, but how do they make sure everyone's getting put in the right tier? What's to stop someone from getting bumped up to a higher tier when they don't really need that level of care?
Well, that's where clear guidelines and careful oversight are going to be super important.
Right. Someone's got to make sure the system isn't being abused.
Exactly. There will need to be safeguards in place to prevent what they call upcoding and to ensure that patients are categorized accurately.
Because that could get really expensive really quickly, not just for Medicare, but for the patients themselves.
Exactly. It'll be interesting to see how they tackle this whole thing in practice.
Another thing that caught my attention in this document is this idea of mandatory quality measurement.
Yes, that's a big one.
So it's not just about providing care anymore. It's about proving that the care is actually good.
Right, exactly. And get this, payments are now being linked to how well providers are doing. It's all tied into the merit-based incentive payment system, or MIPS.
So lots of data reporting, I imagine.
Oh, absolutely. Starting in 2026, providers are going to have to be ready to show that they're meeting quality standards.
I wonder if this could lead to some doctors shying away from more complex cases, if they're worried about how it'll impact their scores.
It's a valid concern. I mean, it's a tough balance.
Yeah.
Trying to provide really high quality care while also being mindful of costs and resources, there's definitely going to be a learning curve here for everyone.
For sure.
Yeah.
So who can actually participate in this whole APCM thing? Is it limited to primary care physicians?
It's definitely designed with primary care in mind, but it's not limited to just those doctors.
Okay, so who else can get involved?
Specialists, for example, who are managing primary care for complex patients, those folks can also participate.
Gotcha.
The key here really is that the doctor, regardless of their specialty, is serving as that main coordinator, the point person, for all of the patient's healthcare needs.
So it's really about taking a holistic view of the patient, not just focusing on one specific issue.
Exactly.
Okay, so let's get down to the nitty-gritty. What does this look like in practice? What kind of services are we talking about here?
Well, APCM actually requires 13 specific services.
13. All right, lay it on us. What are they?
And they're all centered around this idea of comprehensive patient-centered care. We're talking 24/7 access to care, really thorough care management, electronic care planning.
Hold on, 24/7 access?
Yep.
That sounds amazing.
It is. Imagine being able to reach your doctor anytime, day or night, with a question or a concern.
That would be a game changer, especially for folks who maybe don't have transportation or can't easily get to appointments.
Absolutely. It could even help reduce those unnecessary ER visits, give patients more peace of mind.
Right, because you can always reach your doctor. But I imagine that's a lot of pressure on doctors to be available all the time.
For sure, for sure. There are going to be some logistical challenges there. Doctors are going to have to figure out how to make this work without, burning themselves out.
That's a good point. It's not just about the patients, it's about making sure the doctors can handle it too. This whole program feels like a major step forward. It's exciting, but I'm sure there will be some bumps along the way.
Oh, absolutely. It's a huge undertaking. But, the potential benefits are just, well, they're huge too. If APCM is implemented correctly, I think it could really lead to better health outcomes.
That's what we want to hear.
And hopefully lower costs as well. It could really shift our healthcare system to be much more patient-centered.
So everyone listening, I want you to really think about this. Imagine a world where your doctor knows your entire medical history, coordinates all of your care, and is available whenever you need them. Could this be the future of healthcare?
It's definitely a future worth exploring.
That's a great place to leave it. Lots to think about, folks. Thanks for joining us for this deep dive.
Absolutely. It was great to be here.
If you want to learn more or connect with us, please contact Wellbox at www.wellbox.care.